Welcome to our deep dive, into this perplexing world, I guess, of chronic fatigue syndrome.
CFS.
Yeah, CFS, thank you.
Or ME for myalgic encephalomyelitis.
Yes, exactly. So, we're going way beyond just, being a little tired or feeling run down.
Yeah.
This is really, if you can imagine, like, your energy reserves stuck on 1%,
Oh, wow.
no matter how much you sleep.
Right.
That's kind of the reality for those battling this really debilitating condition.
Yeah, and it is debilitating. And what makes it so fascinating, from a medical standpoint at least, is that we don't know what causes it.
Right.
The exact cause still remains a mystery.
Yeah.
And that makes it really hard to diagnose and treat effectively.
That's right. And the source material that you shared really highlights that mystery.
Yeah.
Points to some, possible contributing factors like viral infections.
Right.
And then there's the Epstein-Barr virus being a prime suspect.
Yeah, Epstein-Barr is a big one that we always think about. Immune system dysfunction, chronic stress, and even genetic predisposition.
Right.
It's really just like a puzzle with some pieces missing still.
It's a real medical mystery.
Yeah.
Okay, so let's dive into, what are the hallmark symptoms that set CFS apart from, just being a little tired or run down?
Yeah, so the fatigue, like we were saying, it goes way beyond just ordinary tiredness. This is severe persistent.
Right.
And it's actually worsened by exertion.
Okay.
And exertion could be physical or mental.
Wow.
Even simple tasks, can feel like climbing a mountain after an all-nighter.
Yeah, so it's not just I went for a run and now I'm tired, or I stayed up late working on a project so now I need a nap.
Exactly.
This is like baseline exhaustion.
Baseline exhaustion all the time.
Wow. And I'm guessing sleep doesn't provide much relief.
No. Unfortunately, not a lot of individuals with CFS find it difficult to fall asleep and stay asleep. Even when they do get some shut-eye, they wake up feeling just as drained as before.
So it's like their bodies just can't recharge.
Yeah, they can't properly recharge.
That's going to be incredibly frustrating.
Yeah, it's very frustrating.
The source material also mentions brain fog.
Yeah.
As a common symptom. Could you elaborate on that a little bit?
Yeah, sure. So brain fog, it's more than just kind of everyday forgetfulness.
Okay.
People with CFS struggle to concentrate, remember things, and process information clearly.
So it's impacting their cognitive function as well.
Yes, it impacts cognitive function as well.
Wow. The source material also describes widespread muscle and joint pain.
Yes.
As a key characteristic of CFS.
Yes.
Is there anything unique about the pain associated with this condition?
Yeah. So the pain is often described as aching.
Okay.
And it's widespread.
Oh.
So affecting, muscles and joints throughout the body.
Right.
And what's interesting is that this, unlike other conditions, it's not usually accompanied by visible inflammation.
So there's this disconnect between how someone's feeling and what a doctor might see.
Yeah, what a standard physical exam might reveal.
Right.
Which makes it also harder to diagnose.
Yeah, that must be very frustrating for patients.
It is.
Seeking a diagnosis.
Yeah.
It's like their body's sending these signals, but no one can, recognize them.
Right, and they're in pain.
Yeah, exactly.
So it's very frustrating.
The source material also lists headaches as a potential red flag.
Yes.
Can you tell us more about the types of headaches?
So new or unusual headaches, especially if they're more severe or frequent than usual, can be a sign that something's off, especially for someone who might be developing CFS.
Okay.
That could be a sign that, that could be an early sign.
Interesting.
Yeah.
And to add to the complexity, the source mentions flu-like symptom.
Yeah.
Can also be part of the CFS picture.
Yes.
Why is that?
So it's not uncommon for people with CFS to experience things like sore throat, swollen lymph nodes, and general malaise.
Right.
All things that we typically think of as a cold or flu.
Yeah, exactly.
And that overlap in symptoms can lead to, misdiagnosis or delays in care.
Which is, obviously concerning.
Yes, very concerning.
So it sounds like CFS presents a real challenge for both patients and healthcare providers.
Yes, it does.
So having laid out the complexities of this condition, let's turn to some, potential approaches for managing the symptoms. The source material that you provided dives into two intriguing options.
Yeah.
Voluntary fasting. and cold water therapy.
All right.
Now, I gotta admit, I was a little skeptical at first.
Understandably.
You know, how could intentionally not eating or exposing yourself to cold possibly help someone struggling with extreme fatigue?
Right. It seems very counterintuitive.
Yeah.
But there's a growing body of research exploring the benefits of these approaches, not just for overall health, but specifically for conditions like CFS. However, really, really important to emphasize that these are not miracle cures.
Of course.
And they require very careful consideration.
Yeah.
Especially for someone with CFS.
Absolutely. So let's start with fasting.
Okay.
The idea of someone with chronic fatigue intentionally restricting their food intake seems like it could backfire.
Yeah.
You know, make their energy levels even worse.
Yeah. So it's not about starving yourself.
Okay.
The type of fasting we're talking about is intermittent fasting.
Okay.
Which is, cycling between periods of eating and not eating.
Mm-hmm.
What makes this approach particularly interesting is its impact on our cells.
Okay.
Specifically, these tiny organelles called mitochondria.
Mitochondria. Now, those are the energy powerhouses within our cells, right?
Exactly. They are responsible for converting the food we eat into usable energy.
Mm-hmm.
So imagine them as like little factories with intricate machinery.
Okay.
And over time, this machinery can become damaged.
Right.
And that impacts energy production. And that's where fasting comes in.
Okay. I'm intrigued. How does fasting relate to these cellular powerhouses?
So fasting, specifically intermittent fasting, can stimulate this process called autophagy.
Okay.
And you can think of this as a cellular cleanup crew.
Okay.
That gets rid of the damaged components and recycles them.
So it's like taking out the cellular trash.
Exactly.
And giving those mitochondria a chance to repair and become more efficient.
Exactly. And there's some promising research that suggests that this boosted efficiency could translate into improved energy production.
Okay.
Which is obviously very relevant for people with CFS.
Yeah, who experience that, profound fatigue.
Yes.
But wouldn't the lack of food during fasting periods make that fatigue worse?
Yeah, that's a good point.
Especially for someone already struggling with energy deficits.
Right, and that's why medical supervision is so important.
Yeah.
Because fasting can backfire if it's not done correctly.
Right.
Especially for someone with CFS whose energy reserves are already depleted.
Yeah, they're already running on empty.
Exactly.
So it's not a one-size-fits-all approach.
Wow, not one-size-fits-all.
What would you say are the most important things to keep in mind for someone with CFS who's considering, exploring fasting?
So first of all, never fast if you're feeling weak or unwell.
Okay.
You really need to listen to your body and not push yourself beyond your limits.
Right.
Second of all, stay well hydrated throughout the fasting periods.
Okay.
And when you do break the fast, focus on nourishing whole foods to replenish those energy stores.
Right. Fuel that your body can actually use.
Exactly.
Okay. So it's about making informed choices.
Yes.
And working closely with your doctor.
Yes. Very important.
To tailor the approach.
Yes.
Now let's shift our attention to the other intriguing approach mentioned in the source material.
Okay.
Cold water therapy.
All right.
This one really caught my attention because, my initial reaction to cold is definitely not, I feel energized. It's more like, brr, get me a blanket.
Right.
So help me understand this. How could something like a cold shower or an ice bath potentially benefit someone with CFS?
It's true. The initial shock of cold water can be pretty intense.
Right.
Especially for someone with CFS.
Yeah.
But there's a growing body of evidence that suggests that cold exposure, when done safely and gradually, can have a number of positive effects on the body.
I'm curious to hear more. What kind of benefits are we talking about?
So one key benefit is improved circulation.
Okay.
When you expose your body to cold, your blood vessels constrict.
Mm-hmm.
And then as you warm back up, they dilate.
Right.
So it's like a workout for your circulatory system.
Okay.
Helping to improve blood flow throughout your body.
So it's like a natural way to boost blood flow.
Yes.
And potentially alleviate some of that discomfort.
Exactly. And this boost in circulation isn't just good for pain management.
Oh.
It also helps to deliver oxygen and nutrients to your muscles and tissues.
Right.
Which can lead to a temporary increase in energy levels.
Okay, I'm starting to see how this could fit into the CFS picture.
Yeah.
But I imagine there are risks involved as well.
Yeah.
Especially for someone with a, maybe a heightened sensitivity to stimuli.
Right. You're to be cautious because that initial shock of cold exposure can be a lot for the body to handle, especially for someone with CFS whose system's already under a lot of stress.
Yeah.
So it's crucial to start slowly.
Okay.
and gradually increase the intensity and duration of the cold exposure.
So no polar bear plunges right off the bat?
No polar bear plunges.
What would be a more sensible starting point?
A great way to ease in is to just add a short burst of cold water at the end of your regular warm shower. Begin with just 30 seconds or so. And see how your body responds.
So it sounds like a listen to your body approach is essential here.
It is, absolutely.
Are there any red flags that someone should watch out for that might indicate that cold water therapy isn't right for them?
If you experience any negative effects, like increased fatigue, muscle pain, or a worsening of your CFS symptoms after cold exposure, that's a sign to stop and consult with your doctor.
So this isn't about, pushing through the pain.
No.
And just toughing it out.
It's about finding tools that support your well-being.
Right. Finding what works for you.
Exactly.
Okay. So assuming someone tolerates those initial cold bursts, what kind of benefits might they expect to experience?
One of the most notable benefits is improved circulation. As we discussed, the cold water causes those blood vessels to constrict. And then as your body warms back up, they dilate. And that helps to pump blood more efficiently throughout your system.
So it's like giving your circulatory system a little wake-up call.
Exactly.
And as that blood flow increases, it's delivering oxygen and nutrients to your muscles and tissues, which can contribute to that, boost in energy and alertness.
Right, and some people report feeling more alert after.
Interesting. And then there's that mood-boosting aspect we talked about. How exactly does that work?
So cold water exposure, it acts as a stressor on the body. And in response, your system releases endorphins. Those natural mood elevators and pain relievers.
Interesting.
So it's like your body's way of helping you cope with the challenge. And you're left feeling more energized and positive.
So it's like this natural mood booster.
Yeah.
Built right into our physiological responses.
It is.
That's pretty remarkable.
It is.
Now, I'm not saying a cold shower is going to cure CFS. But it sounds like a potentially valuable tool for managing symptoms and improving overall well-being.
Exactly.
Now, before we delve deeper into the specifics of fasting and cold water therapy, let's take a step back and consider the bigger picture. We've been talking about these approaches as potential tools for managing CFS symptoms, but what does that really mean for someone living with this condition day in and day out?
So the reality is that CFS is a complex condition. And there's no one-size-fits-all solution. These approaches, while they can be helpful, are not intended to be standalone treatments.
So where do they fit into the overall management of CFS?
They're complementary strategies that might help improve symptoms, enhance quality of life, but they need to be integrated into a comprehensive approach.
It's not just, I'm going to take a cold shower every day and I'm cured. It's
about lifestyle changes, other treatments potentially.
A whole bunch of different factors. So it's about building a personalized toolkit with these approaches potentially being valuable additions.
Exactly.
But it's essential to remember that research into CFS is ongoing.
Yes. Definitely.
There's still so much we don't know.
There is.
Absolutely. The more we learn about this complex condition, the better equipped we'll be to develop, more effective treatments and provide better support for those living with CFS.
Absolutely.
And that brings us to, a crucial point. Knowledge is power.
Yes.
Especially when it comes to your health.
It is.
The more you understand about CFS, the better advocate you can be for yourself.
Absolutely.
I completely agree. And that leads us to a question I'd like to pose to our listeners. As we wrap up this part of our deep dive. We've been talking about how fasting and cold exposure can potentially influence inflammation and cellular processes. What other lifestyle factors might have a more significant impact on managing CFS than we currently realize? Things like diet, exercise, sleep patterns, or even environmental factors.
All of that could play a role.
Could hold clues to, unlocking a better understanding of this condition.
Absolutely.
It's definitely a thought-provoking question.
It is.
So as we move into the next part of our deep dive, we'll delve further into the specifics of fasting and cold water therapy. Examining the potential benefits and risks in more detail.
Sounds good.
Stay tuned.
Welcome back. So before we move on to cold water therapy, I want to touch on another potential benefit of fasting that might be particularly relevant for those of you exploring ways to manage CFS.
Okay, you've piqued my curiosity. What else can this, intentional food break do?
Well, we've talked about the potential for cellular cleanup, boosting those mitochondrial powerhouses.
Right.
But there's also evidence to suggest that intermittent fasting can improve insulin sensitivity.
Okay, I'm familiar with the term insulin, but remind me how it fits into the energy equation, especially in the context of CFS.
Absolutely. So
Yeah.
insulin is a hormone that helps our cells absorb glucose from the bloodstream to use as energy.
Okay.
And when we talk about insulin sensitivity, we're referring to how effectively our cells respond to insulin's signal. In some cases, cells can become resistant to insulin, meaning they require more of it to absorb the same amount of glucose.
Right.
And this resistance can lead to fluctuations in blood sugar levels.
Okay, so those are those, spikes and dips you might experience after a meal.
Exactly. Those energy crashes after a big meal or a sugary snack.
Yeah, I've definitely experienced those.
Yeah. And those blood sugar fluctuations can be especially problematic for someone with CFS.
Okay.
They already struggle with low energy levels, and these dramatic swings can exacerbate their fatigue.
Yeah, it's like trying to drive a car with a sputtering engine.
Exactly. It's going to be a much bumpier and less efficient ride.
Right. It makes sense.
So by improving insulin sensitivity through intermittent fasting, you're essentially helping the body regulate those energy levels more smoothly.
So it's like providing a stable power source instead of relying on those erratic bursts of energy.
Precisely. It's like fine-tuning your body's internal energy system to run more efficiently.
That makes a lot of sense.
Potentially leading to more sustained energy throughout the day, which could be a game changer for those dealing with the persistent fatigue of CFS.
Right, because that's the hallmark symptom.
It is.
Is that just overwhelming fatigue?
Yeah.
But I'm also mindful of the potential downsides we discussed earlier. It seems like a delicate balancing act. Finding the right approach to fasting without triggering those negative effects.
You're absolutely right. It's not as simple as saying fasting is good for everyone.
Right.
Individual responses vary greatly, and it's crucial to approach this with caution and personalized guidance from a healthcare professional.
So you really have to work with your doctor on this.
You do.
It's not just something you can, decide to do on your own.
Exactly.
Okay, so what are some key takeaways for someone with CFS who's considering intermittent fasting under their doctor's supervision?
The most important thing is to pay attention to your body's signals.
Okay.
Never fast if you're feeling weak or unwell. If you're feeling good and ready to try it, remember that hydration is key.
Okay.
Especially during those fasting periods.
Right.
And when you do break the fast, prioritize those nutrient-rich whole foods to replenish your energy stores.
Got it. Stay hydrated, listen to your bodies, and fuel up with healthy choices.
Exactly.
Okay, so we've covered fasting in some detail.
We have.
Now let's plunge into the chilly waters of cold water therapy.
Go ahead.
The source material highlights several potential benefits, including improved circulation, reduced inflammation. You mentioned earlier that it might also have mood-boosting effects?
Yes.
I'm curious to hear more about that.
Yeah, so cold exposure can trigger the release of endorphins.
Okay.
Those feel-good chemicals that naturally elevate our mood.
Yeah, those are the things that, get released when you exercise.
Exactly.
When you're feeling good.
Exactly.
Right.
So in addition to the potential physical benefits, there's a mental component as well.
Interesting.
Which could be really beneficial for someone dealing with the, often debilitating fatigue of CFS.
Yeah, so it's not just about, the physical sensations, it's also about how you feel mentally and emotionally.
Right. It can have a positive impact on your mood.
That's fascinating. But I still have my reservations.
Understandable.
I'm picturing myself taking an ice-cold shower and feeling anything but invigorated.
Yeah.
What about those potential risks we touched on earlier?
Right.
What are the things to watch out for?
So it's crucial to remember that individuals with CFS often have heightened sensitivity.
Right.
So the initial shock of cold exposure can be quite intense. That's why a gradual approach is key.
So no jumping into a freezing cold pool on day one?
Definitely not.
Okay, good to know.
Start slowly and gently.
Okay.
A great way to ease in is by adding a short burst of cold water at the end of your regular warm shower.
Okay.
Begin with just 30 seconds or so.
Okay.
And as you become more accustomed to it, you can gradually increase the duration and intensity.
Okay, so baby steps are crucial.
They are.
What about those potential downsides? What are some red flags that might indicate that cold water therapy isn't a good fit?
It's essential to listen to your body's feedback.
Okay.
If you experience any negative effects, like increased fatigue, muscle pain, or a worsening of your CFS symptoms. After cold exposure, stop immediately and consult with your doctor.
So this isn't about pushing through discomfort or trying to tough it out.
No, it's not.
It's about finding tools that support your overall well-being. That's finding what works for you.
Exactly.
Okay, so assuming someone tolerates those initial cold bursts, well,
right.
What kind of benefits might they expect to experience?
One of the most notable benefits is improved circulation.
Okay.
As we discussed, cold water causes blood vessels to constrict, and then as your body warms back up, they dilate.
Right.
And this process helps to pump blood more efficiently throughout your system.
So it's like giving your circulatory system a little wake-up call.
Exactly.
And as that blood flow increases, it delivers oxygen and nutrients to your muscles and tissues.
Right.
Which can contribute to that temporary boost in energy and a feeling of alertness that some people report.
Right. Some people do report feeling more alert after.
Interesting.
Yeah.
And then there's the mood-boosting aspect we talked about.
Yes.
How exactly does that work?
So cold water exposure acts as a stressor on the body.
Okay.
And in response, your system releases endorphins, those natural mood elevators and pain relievers.
So it's like your body's way of helping you cope with the challenge.
Exactly.
Leaving you feeling more energized and positive.
Right, and that can be really helpful for people with CFS.
So it's like a natural mood booster built right into our physiological responses.
It is.
That's pretty remarkable.
It is pretty remarkable.
Now, I'm not saying a cold shower is going to cure CFS.
Right.
But it sounds like a potentially valuable tool for managing symptoms and improving overall well-being.
Exactly.
Both fasting and cold water therapy offer intriguing possibilities.
They do.
But it's essential to approach them with a balanced perspective, understanding both their potential benefits and risks.
You have to weigh the pros and cons.
Right, exactly.
And make sure it's right for you.
It's about finding what works best for you as an individual in consultation with your healthcare provider and recognizing that these are just two pieces of a larger puzzle when it comes to managing CFS.
Absolutely. A holistic approach that encompasses a variety of strategies.
Right.
Including diet stress management techniques and other medically recommended treatments is essential for overall well-being.
Okay, so we've explored the potential benefits and risks of both fasting and cold water therapy.
We have.
Now let's shift our focus to the bigger picture. What does all of this mean for someone living with CFS day in and day out?
Right.
What message do we want to leave them with as we wrap up this part of our deep dive?
I think the most important message is one of hope and empowerment.
Okay.
CFS is a challenging condition. There's no doubt about that.
Yeah.
But it doesn't have to define your life. There are things you can do to manage your symptoms, improve your quality of life, and find a sense of normalcy.
And knowledge is a powerful tool in that journey, right? The more you understand about CFS,
it is,
the better equipped you'll be to advocate for yourself, make informed decisions about your health, and connect with others who understand what you're going through.
Absolutely. Don't be afraid to ask questions. Seek out reliable information and reach out for support. There are incredible resources available both online and in your local community that can connect you with others who are navigating this journey.
Right.
You're not alone in this.
Those are powerful words of encouragement.
Thank you.
Now, before we dive into the final part of our deep dive, I want to leave our listeners with something to ponder.
Okay.
We've been discussing how fasting and cold exposure can potentially influence inflammation and cellular processes.
Right.
But what other lifestyle factors might play a more significant role in managing CFS than we currently realize?
That's a fantastic question.
You know, could things like diet, exercise, sleep patterns, or even environmental factors have a more profound impact on this condition than we currently understand?
It's a question worth exploring.
It is.
And I think it highlights the fact that there's still so much we're learning about CFS.
Yeah.
And it invites us to really explore the connections between our daily choices and our overall health.
Yeah, for sure.
You know, what impact are our choices having on our health, both good and bad?
Exactly. And maybe there are some simple things that we're overlooking.
That's possible.
That could make a big difference.
Right.
So as we move into the final part of our deep dive, we'll circle back to the source material, consider those potential benefits and risks in more detail, and explore those broader lifestyle factors that might hold clues to unlocking a better understanding of CFS. Stay tuned.
Welcome back to our deep dive into chronic fatigue syndrome. We've covered a lot of ground exploring the complexities of this often misunderstood condition.
Yeah, it really is complex.
And we've delved into, two intriguing approaches that might offer some relief.
Right.
Voluntary fasting and cold water therapy.
Right. And we've emphasized that, both of these approaches require careful consideration.
And personalized guidance.
Absolutely. Especially for someone, navigating the challenges of CFS.
Exactly.
It's not about jumping into the deep end.
No.
Without understanding the potential risks and benefits.
Or being informed.
Right. It's about making informed choices in collaboration with your healthcare provider.
Yes.
That support your individual needs and goals.
Exactly. And while these approaches hold promise, it's important to remember that they're not intended to be standalone treatments for CFS.
Right.
They're tools that can potentially be integrated into a broader holistic approach to managing this complex condition.
So as we wrap up this deep dive, let's bring it all together. If someone's listening to this, perhaps they suspect they have CFS or they've recently received a diagnosis.
Right.
What's the most important message we want to leave them with?
I think the most important message is one of hope and empowerment.
Okay.
CFS is undoubtedly a challenging condition, but it doesn't have to define your life. There are steps you can take to manage your symptoms, improve your quality of life, and find a sense of normalcy.
And knowledge is power, wouldn't you say?
Oh, absolutely.
The more you understand about CFS, the better equipped you'll be to advocate for yourself, make informed decisions about your health, and connect with others who share similar experiences.
Exactly. Don't be afraid to ask questions. Do your research and seek out support. There are wonderful resources available, from patient advocacy groups to online communities.
Right.
Where you can connect with others who understand the journey you're on.
Yeah, you're not alone in this.
You're not alone.
Those are powerful words of encouragement.
Thank you.
And as research into CFS continues to advance, we can be hopeful that more effective treatments, and perhaps one day even a cure will be discovered.
Absolutely.
So to our listeners, we encourage you to continue your journey of discovery, keep asking questions, keep digging deeper, and most importantly, never lose hope until next time. Stay curious and keep exploring the fascinating world around us.
And remember, knowledge is power, especially when it comes to your health.